102.7 WMOM on your station playing your hit music. It is WMOM 831, and in the studio with us, a couple special guests that we're going to be talking to in the next couple of moments here from Corewell Health. Fritz Petersen is in the studio with us. Good morning, sir. How you doing?
Good morning. Good to have you.
And glad to have you here. We're going to be talking with you over something that relates to our Ludington Area Public Schools. Fritz Petersen, the specialist, a virtual health specialist there at Corewell Health, both Ludington and Gerber. And as well in the studio with us is Dan Mesher, the principal of Ludington High School. How you doing, sir? Thanks for coming
Wonderful. Thanks for having me.
Absolutely. We're going to be talking with you more even after this segment because we've got, OBOTs to talk about. We have, what else is it's a big day for
BPA, our Business Professionals of America group, is off to state. They got a police escort here that went through. Band, talk about our band that went to competition yesterday, and construction updates and much more.
All right, so looking forward to that. Fritz, let's chat about, because this topic is really going to be important for those that maybe have students in the public schools here in Ludington, and even those that don't have students, to know that we're taking care of our kids and we're trying to do it as best that we can, and Corewell Health is a huge part of that. And we're going to be talking about something called Title Care, which you have something here that you're going to show the cameras. And if you want to watch this, you can do it on our Facebook page and our YouTube channel. But that would be my first question, Fritz, is how important is it this day and age for the healthcare providers out there to be intertwined with our schools and our kids?
Yeah, Corewell Health has a lot of strategic partnerships, and one of the most important ones for us here in this community is our partnership with Ludington Area School District. So it is just a tremendous opportunity to partner with the in-person nurse there, Beth Standish, who is a Corewell Health nurse contracted through the schools as a school employee. So she does a great job managing the day-to-day health of our students there, and we wanted to, with this collaboration, take it a step further and offer primary care video visits virtually for our students in the school during school hours, so mom and dad don't have to go through that hassle once they pick their kiddo up. So
and this is truly what we've seen over the years, like on TV and stuff like that, where you have video, the doctor's on the other end or the healthcare provider, and able to have that one-on-one conversation with that child, and Beth in the room and helping out with this.
Absolutely. She's facilitating the whole time.
Okay.
We'll make sure and get mom and dad or guardians' consent. But really with this, ever since the pandemic, we all know that virtual everyone's become very comfortable with virtual. Everything from healthcare to working. Probably many of us are still in that hybrid mode of work where we're in the office some days and virtually the other part. So virtual is here to stay, and healthcare is no different. So what we wanted to do with this collaboration is not only offer video visits for kind of those low acuity, and what I mean by low acuity types of things are the things that are the provider doesn't need to lay hands on a patient. They can treat easily via video, right? So those are your skin conditions like rashes and insect bites, pink eye, earaches, those types of things. So it's great, and our providers are really able to do well with treating those via video. But to take it a step further, what we have equipped Nurse Beth with is a Title Care kit. And this is an awesome device here. I'll hold it up for those of you that are watching. Yeah. This is a little device that our nurse will have so that when she connects with our providers, those providers are, traditionally, when we're doing a video visit, it's basically just a video feed, right?
Yeah.
It's a video feed, and the provider can ask the patient questions, and then they come up with a treatment plan just from that video feed, and then asking and answering questions, that dialogue. But with this kit here, our providers can glean so much more information. So there is built into this little device, there's a thermometer, there's a HD camera, and there's various attachments. So there's a stethoscope attachment, so that provider can listen to heart and lung sounds. There is a tongue depressor, so we can look down the throat.
Wait, and there's a camera in it to be able to do this?
Absolutely.
Wow.
There's even an otoscope lens, so if the child is complaining of earaches, they can look in and see if there was an ear infection. And if there is an ear infection and an antibiotic is needed, then we'll call it into the pharmacy, the preferred pharmacy of the parents. So all this during the school day to hopefully ease up that burden on parents. So.
Principal Mesher, just hearing that part of it, I would assume that, and you know about this already because you're working obviously from the high school and the middle school, and then obviously the elementary side of things. But to hear this technology is available to your students, that's got to be important to you.
That's amazing, I think, to see how far technology has come. And I've used, teleservice before with health when I couldn't get in, but this is a whole nother level than 3 or 4 years ago. And just for families to know that we have that ability, obviously it's really being utilized at the K-5 level. Beth down there is doing a tremendous job. She's busy. Usually older students know when they're not feeling well, and they sometimes stay home. But, there are opportunities that we're trying to promote this that, we call a parent, they're not feeling well. Well, they're 40 minutes away at work. They can't come get them. And this is an opportunity that we can utilize this technology too. So we really want to promote this, not just K-5, but all across the district. It's a great partnership.
Do you see parents embracing this from your standpoint? I'm going to ask that same question from Fritz's as well. But we do have to do more education to make sure that parents are aware of it?
I think definitely do more education. I know that's something we talked about in our newsletters, our parent advisory groups. Really get that out there and let them know just what a wonderful partnership we have to help families out. And that's what it's all about, is helping these families connect so that their students are safe.
We're talking this morning, if you're just joining us, Fritz Petersen is a virtual health specialist at Corewell Health, Ludington and Gerber, and as well Principal Dan Mesher from Ludington High School in the studio with us. Fritz, sort of that same question, if you don't mind, when the parents are actually realizing that their kids are benefiting from this and they're able to stay at work, they're able to have that reassurance that their child is okay or maybe does need to take that next step, it's probably a game changer, isn't it?
So I will tell you, the very first time after we launched this, it was, I think, the second week of October where we finally were able to launch this and get it off the ground and get the kit in Beth's hands. Our first usage was a Friday at about 2 o'clock, and a child was complaining of an earache. And so we did the visit, and they looked at it and said, yep, there's an infection. Let's call in antibiotic. So take this out of the equation, and the parent would have had to come in and pick up their child or wait till the end of the day, then manage the piece of, okay, I got a call at the end of the day on a Friday, my physician's office, to see if they can maybe squeeze us in, at the last minute, at the end of the day. So they might be able to get them in, they might not. Otherwise, that child could wait all weekend with a treatment that could have been done that afternoon. So.
And this is 15, 20 minutes in that office, and it's a private office setting. It's like if you're going to your doctor, you have that clinical room there.
Absolutely. Yep. Beth has her own office where she sees kiddos as they're needed and does the visit privately, and it's done securely over the school's wireless Wi-Fi network. So. Okay. Just a fantastic service.
What about is it real time as well? I know we talked about the camera in the Title Care, but on the other side, is the doctor actually seeing those vitals come in almost virtually real time?
Yes, absolutely. Okay. So as this is transmitting information, for instance, heart and lung sounds, they're hearing those sounds, and then they're also able to record them on their end, and then it goes into the patient's chart.
Principal Mesher, Dan, in the studio with us as well. Back in the day, I would assume that if somebody, one of those kids gets sick, it spreads very quickly. Something like this must be a reassuring, at least slightly on your part, we can stop things or prevent things or slow things down, right?
Well, it gives us an opportunity to encourage students if they're not feeling well. To come down and we can check you out. I think that's the best thing that we have going on. Beth is busy, but she goes back and forth. She's in in the high school and the middle school weekly. She goes back and forth. We're really excited about the construction because she'll have her own office, state-of-the-art office at both locations. I think it's an opportunity to keep our entire school healthy. With this type of technology, it's just amazing how far it's come just the last 3 years.
That's pretty cool. Let's talk a little bit more about the actual process, if you don't mind, Fritz. Dan had mentioned that, again, older kids, we tend to, we kind of know what we're dealing with or how we're feeling. But younger kids, maybe not expressing as much. Take us through that entire path, if you don't mind, from the teacher standpoint to getting to Beth, to getting that information to that parent.
Yeah, right. I think it all starts in either the classroom or out in the playground at recess, right? So the student will have signs and symptoms that something is wrong, and they get sent to the nurse's office, and that's where Beth kind of does her triaging work and says, okay, will this be appropriate for a virtual visit with the Tidal Clinic device, or is this maybe something else? Obviously, if it's stitches or something like that, we're going to escalate to the appropriate means of care. But if it is appropriate for a Tidal Clinic device video visit, then we will first and foremost call mom and dad and get consent. And then the only real requirements is the student does have to have an active MyChart account.
Okay.
And so that allows us to send that e-check-in to the parent, where they can choose their preferred pharmacy. They can consent for the visit. They can go over a brief medical history, so our distant provider kind of knows a little bit of the background of the patient, and then they'll sign up a time for the student to be seen virtually. So it's
and that
as easy
happens
as that.
basically the same day in most cases.
Oh yeah, within minutes.
Okay,
Yep.
Fantastic. And we're talking from the notes that I have on this is we're dealing with asthma and allergies and cough and cold, earaches, from fever, flu, headaches. Head lice, pink eye, rashes, skin conditions, and sore throat, just to name a few.
Yep.
That handles a lot of things that we see as problems in schools these days.
I mean, I get poison ivy almost every summer from, going around in the woods. Yeah. And so, rashes, skin conditions, I mean, Beth, I know, sees a lot of that type of stuff. So this is a perfect application for that.
Two other things we want to transition into is the waits at doctor's offices. This obviously reduces that. Sending them the kids to the hospital, because we've talked about that between emergency care versus their doctor versus the clinic. This really kind of helps filter or at least slow down that process, so you're not waiting in that waiting room for a long period of time.
Nobody wants to go to the emergency department and wait in that waiting room for longer than they have to. Walk-in clinic, same thing. And your provider's office, maybe they can squeeze you in the same day, maybe not. You're kind of on their terms. So this is just a great added access. In this day and age, we want to make things as easy for people to connect as possible. So we want that one click as much as we possibly can, right? And this is a step towards that.
And affordable as well. Let's talk about the cost, insurance, stuff like that. Take us through that.
This is a billable, so it is never more than $45. So yes, it's $45, but look at the cost of an ED visit or urgent care, and it's much, much more. So this is a much more affordable option for families, as well as if there's no coverage from insurance at all, it's still no more than $45.
All right. How do we, we're doing it this morning by informing the parents and the public about this option there, but what else can we do to try to get this information out to parents and to others that this is available out there? Is there work being done there?
Yeah, I think working with our hospital's marketing team is definitely a piece of that. And like anything new, it usually takes a while for it to kind of gain momentum. So we're hopeful that being this the first time school year that we're offering this, that even next year it'll be even better. So
all right. Anything that we missed this morning that you want to share with the audience at all?
This device, this TidalCare device, is also available for home use.
Oh, really?
So patients can buy this. You can get it at Best Buy for $299, or you could go through Corewell Health corwell.org, and you can get it for $99.
Wow.
So we do have an exclusive relationship, partnership with Title Care, and so the cost is really significantly reduced. The kit itself is super easy to use. Even the parts, the otoscope covers and the tongue depressor, they're dishwasher safe, so they're reusable in that manner. So it's just a great option for people to increase their access to care when they want care, when they need it, 24/7.
I have to ask both of you this same question then. Fritz, do you see this as the future?
Virtual is here to stay, and so it's going to be exciting to see where that goes. So I think people, again, when the pandemic kind of forced our hand to go virtual with a lot of things, that really increased the comfortability, and so I think it's so widely adopted now that it's commonplace.
And Principal Mesher, I would assume this was part of those conversations as well. How do we, tackle this? And this is an opportunity for the kids to stay in school as much as possible, and tackle that. And I'm sure that's been part of the conversations, right?
Choice is a great thing, and giving parents an opportunity, choice. But this is customer service at its finest. So I think giving parents a choice to be able to, whatever their individual situation is, it just is the next level of customer service by our local hospital, by the school system, to make sure that their child is healthy. And it's a great partnership, and I think we're just scratching the surface at it right now.
All right, sounds good. Fritz, I appreciate you coming in and talking about it, and we'll dive into this in the future and keep track of it. It just started last October, and obviously we want to make sure that we keep the word out there. So Fritz, thanks for coming in this morning.
Thanks so much for having me.
Absolutely. And Principal Mesher is here. You're going to stick around for a few minutes too. We're going to be talking to you about what, OBOTs and what else? A band,
BPA, swim team, construction. A lot of great things going on.
All right, sounds good. That's coming up in about 10 minutes from now here on 102.7 WMOM. Stick around, and if you missed any part of this segment, check it out on our Facebook page at WMOM. It's archived there, and our YouTube channel as well, 102.7 WMOM. It's Chris here on 102.7 Mom FM.